So we usually kickstart the episodes by asking you why you decided to become a pharmacist in the first place.
So I guess for me, I think for any sort of teenager, 15, 16 year old, trying to figure out what it is that you want to do is just, crazy. How at that age do you expect to know what you want to do? And so for me, I think it was I liked science and I liked talking. So what profession can I find that accommodates the both of them? And I think for me, a I wanted a degree which I could then get a job out of quite easily, I guess. Um, and so pharmacy kind of just seemed like a good fit. But it was only when I kind of did work experience for a couple of weeks did I realize, okay, yeah, pharmacy is really for me. So I worked in a community pharmacy, and there are so many misconceptions, as we're all aware of, with community pharmacy. And being at that age, admittedly, I had all those misconceptions as well. And it was only sort of being on the other side of it, seeing what the pharmacist does, seeing how the pharmacy teams work, sort of the challenges that they have to overcome, and that pharmacist just being a pillar in that community and just being a fountain of knowledge to people. I've really admired that. And so for me, it was like, okay, I think, yeah, this is what I want to do. I can see myself doing this, I think. And yeah, just went from there, really.
Yeah, there's a lot of chat in community pharmacy. It's
Yeah.
good. If you like talking, it's a good place to be because, once you get to know your customers, there's, the regular banter, the
Yeah.
regular conversation about how you are, the family members, and you feel, like you said, you're the pillar of the community and you really feel like you're
Mm,
at the heart of the community in community
very
pharmacy,
much.
which as a student, I worked in community pharmacy, and that pharmacy that I worked at was really, really good. And those misconceptions are sometimes due to the specific pharmacy you might have worked at and might not have suited you. And it's always good to kind of try, whether it's starting off with a big chain or kind of retail pharmacy and then trying out an independent. Because for me, I think independent pharmacies suit me so much more than working for the bigger chains. Um, they are very much business oriented in the same way. They're money making machines, aren't they? Though they are patient centered. But at the same time, I feel when I worked in it was quite a small town, like a small village. You got to know the patients really, really well. And that was the aspect of the role that I enjoyed. And this is, back in 2005 when I had just started my undergraduate degree. So that really gave me that exposure to all of the over the counter medications and providing, minor ailment advice, which I thought, yeah, this is good. This is a great career to be in.
No, I agree, and I think for me, so my background is community pharmacy, and so I've locumed, been a relief pharmacist, tried to sort of see or be in sort of every community pharmacy type that you can think of. So, like you said, your high
Mm,
street, your small independents, your bigger chains, those affiliated with sort of drug and alcohol misuse clinics, care homes, etc. So you kind of find what setting works for you. And I think that's another thing with community pharmacy is that we say community pharmacy like it's just one thing, but actually there's so many different types of community pharmacies out there. And especially for newly qualified pharmacists, those who are early in their career, they might actually find that, yeah, one particular type of community pharmacy doesn't work as well for them as, say, another type does. So it's kind of exploring what, as you said, what works for you and where you see yourself fitting into as well.
yeah, and I definitely think even from university stage, it's a really good idea to get that work experience and start identifying what you're good at, what your skills are, what type of role you think you can see yourself in. You may work with patients and be like, no, this is not for me. Like, you might want to become an IT savvy pharmacist or, go into leadership and work in the operational side of pharmacy. So it's a really good idea to kind of get that experience from the beginning stages. Um, and I know a lot of the students that I work with at KCL have summer placements and kind of weekend jobs and things, and they use that to their advantage in terms of learning who they are and what they want to become. Did you know in the university stages that you wanted to work in community pharmacy, or did you explore other options as well?
I think quite early on, I knew that community was for me. I think I'm just generally one of those people that hospital settings make me a little bit queasy, which as a
Okay.
healthcare professional, I probably, it's just one of those things. Have always sort of felt a little bit, oh, with just being in hospital in general. And of course, working in a hospital is very different to, visiting a sick relative in hospital, for example. But I think because I had almost that association with a hospital setting, it was always quite hard to kind of shake off. Um, at least that's what it was at the time. Now I'm fine, but at the time that was kind of my perception. And even at university, they had organised for us to get placements within hospital, and it just wasn't for me at that time. And I think very much the patient facing aspect of it was something which really appealed to me for community pharmacy, being able to build that relationship and rapport with patients, um you know going on that kind of journey with them. So yeah, I'd say from early on, I kind of realized that community pharmacy is probably where I fitted into. um and I guess in many ways, I didn't really know much else about hospital pharmacy aside from that placement that I did. I didn't really, because I hadn't had like a full extensive placement there. It was just 1 week, so I didn't really know exactly what roles and responsibilities entailed fully to be a hospital pharmacist. So yeah, I'd say for me, community was kind of where my heart was, and then where I
Yeah.
kind of wanted to follow it really.
Yeah, no, fair enough. I mean, my parents owned a pharmacy for 20 plus years, so I grew up in one. Though
Yeah.
they're not pharmacists, they owned a pharmacy, so I knew obviously what it was all about. And then going to a community pharmacy throughout my university years and, working weekends, all holidays, I knew I really enjoyed it and I could see myself working there. But I was really tempted by looking at the other jobs that were available to me. And, I worked really hard to try and get that hospital pre-reg because I wanted to really see how I would fit into that environment. And I went in there and it was like love at first sight. Like I genuinely really enjoyed every aspect. And the main thing that I loved was the
Mm.
variety of just the workload, the people, the big team, working with nurses, working with, doctors, physios, OTs. Like I really enjoyed that environment of just meeting and networking with other healthcare professionals. Now, you do that in a community pharmacy, but it's just different because usually it's over the phone or some sort of virtual conversation. So whether you build that rapport or that rapport that you do build is slightly different, because you may only have that interaction a couple of times a day for a few minutes. And it's usually, I need to get a job done. I need help with this prescription. Can you send us a new one? All those kind of like interventions that you make.